And so welcome once again, Ms. Sylvia Lemus, and thank you for all the information that you bring to us. If you could just give us somewhat of a brief, you know, bit of information. But I think that the most important thing today, especially for our English-speaking listeners, like there's a lot, it's easier, I would say, for them to really find a lot of the information that we have to go really in detail for the Spanish-speaking community. But I think that one of the things that they need to know is exactly what happened today with the governor and what is happening with these new restrictions in parts of California.
Yes, okay. So today, Governor Newsom had a press conference where he unveiled the regional stay-at-home order, which will go into effect in, it's not affecting us currently right now, but it's going to go into effect in regions, and the measures is regions with less than 15% of ICU availability in hospitals. So he identified the 5 regions in California that will be impacted, and the regions encompass most of the state. Sonoma County falls in the Bay Area region, um, which has the highest ICU capacity in the state, so that's good. But if trends continue the way that they have been going, the state's projecting that the ICU capacity in our county will fall below 15% in about mid to late December. So then that's when the governor's new regional stay-at-home order will go into effect. The rest of the state will most likely trigger these restrictions in early December. And you can find ICU data on our SoCo emergency. We have a hospital capacity dashboard, so you can find information on our ICU data. Once it's triggered, we'll have like 48 hours to implement the new measures. And it prohibits, for example, private gatherings of any size. It closes sector operations except for critical infrastructure and retail, and requires 100% masking, face masking, and physical distancing from all others. And schools that have received state waivers will be allowed to continue in-person activities. Non-essential travel will not be allowed. So I can discuss, if you want, some of the sectors that have to close.
I think that would be essential so that people, the reality is not whether or not it's going to happen. In the direction that we're going, one of the things that you mentioned previously in Spanish is, for a while we were in the 70, 76, 78 people getting sick. The other day we had over 300 on Wednesday, I think it was, Tuesday. Now we have over 130. So the numbers are increasing, and we are not even seeing yet the numbers from the last week gatherings that, again, thousands and thousands of people did that. And so it's going to happen. It's not whether or not it's going to happen. So if you could tell us exactly who's likely to be affected.
Yeah, so we're still in the purple state, our numbers are getting a little better. But for example, if this happens, then when ICU capacity drops below 15%, the following sectors have to close: indoor and outdoor playgrounds, indoor recreational facilities, hair salons, barbershops, personal care services, museums, zoos, aquariums, movie theaters, wineries, bars, breweries. A lot of these have already been closed because we've still been in the purple stage, so this affects all sectors. But sectors that will have to be modified: outdoor recreational facilities, they can operate outdoors only without any food or drink or alcohol. Additionally, no overnight stays at campgrounds, not permitted. Retail indoor operation will be permitted 20% with a metered entrance, so they'll be checking the number of people that go into the stores. No eating or drinking in the stores. Additionally, all stores have to institute special hours for seniors and for people with chronic conditions or compromising immune systems. Shopping centers, same thing, 20% capacity with metered entrance into the locations. Hotels and lodging open only for critical infrastructure support. Restaurants, that's a change. It's going to be hard for our restaurants because they can only be open for takeout, pickup, and delivery. And a lot of them had been investing in like tents and different things to have outdoor heaters and things. So if we go into this new measures, that's going to change and only allow takeout, pickup, and delivery. Offices will have to go to remote only except for critical infrastructure when remote working is not possible. Places of worship, a political expression, outdoor services only. So those are just some examples of some of the changes that will happen, and they're really, really stressing. No, don't get together with other people that are not part of your household. To try to limit that and really restrict that limitation of being with people that are not in your household, and using your mask and keeping physical distance.
Definitely. And then I would say if you could just give us two more items just to
Mhm.
be able to be respectful of my colleagues who are
Yes.
waiting for the next interview. And that is, are we still giving out as a county gift cards for people who take a test in certain locations?
Yes, there was a little change with the gift cards. I'll kind of explain that. But to offset, we do give gift cards to offset transportation costs and any kind of like time away from work to get the test. So we had been giving them out at test sites, but now what we're doing is we're going to be mailing them to people because we want to make sure people are over 18 years old that they live in one of the target areas because we want to really encourage people that live in a target census tracts that we are working within for the pop-up testing and that they have not received a gift card in the last 30 days. So some of the requirements. And so instead of giving them at the pop-up testing with the basic data that we get, we're going to mail out the gift card. So we are still doing that.
Definitely. And my last question for you is, again, we want everybody to continue to get tested. What is the phone number in
Mhm.
Sonoma County that people can call to get tested?
Yes, we are doing testing like 6 days a week, every week. We're increasing testing even. We're opening up a new site in Petaluma, but people should call. That's the best way. Call, make an appointment. It's 565-4667. And you can also go online and schedule an appointment online as well.
Okay, and with that, as always, I want to thank you. We've been doing this for months, and
Mhm.
I'm grateful with the partnership that we have going on. And again, thank you for the masks that you have been
Of
giving
course.
us. And
Yes.
so far, I think between the masks that you gave us and masks that we got somewhere else, we
Mhm.
have given a collaboration of the Hispanic Chamber, MECHA, and many
Mhm.
other organizations. We have given out over 10,000 masks, I think, by
Wow,
now.
that's
And on
great.
Monday at Santa Rosa Junior College, I'll be giving out another probably 1,000 masks.
Uh-huh.
At this moment, we're waiting to hear the final numbers.
Mhm.
So again, I'm grateful for the collaboration, and I look forward to our next
Thank
conversation in the
you.
very near
And
future.
just we
Thank
just want
you.
to remind people, just continue with the protocols of, use your mask, wash your hands, keep your distance. We have to kind of stay in this for a while longer. Mhm.
Especially if we don't want our small businesses to be affected.
Right.
Thank you.
Okay, thank you. All right,
All right,
bye.
bye bye. Y ahí tiene una vez más la conversación.